So, Marty, in your long career at the U of M, you were involved in groundbreaking longitudinal research on child maltreatment, both abuse and neglect. So tell us about that research and some of the key findings you think are most important for people to understand.
Okay. Well, I had the good fortune back in the 1970s, the late 70s, when I was starting work on my doctorate at the University of Minnesota, to get connected to a researcher by the name of Byron Egeland. He was a professor in educational psychology at that time and then went on into the Institute of Child Development, and he started this really groundbreaking longitudinal study, what's called a prospective longitudinal study. That is recruiting pregnant women and their babies, still in utero, and following them forward from the time of this pregnancy up to the present time, actually, and certainly up through the time that these babies were in their 40s when the research was really going strongly. And so I had the good fortune to get connected to that research initially as part of my doctoral studies, and then continued throughout my career at the university to work both on that initial study, which was known as the Minnesota Study of Risk and Adaptation, and then on an intervention study that related to the same professor, Byron Egeland, who worked with me on developing a preventive intervention program for high-risk mothers and babies, and fathers and other family members, but with the women as the point of entry into the family. So that really kind of defined a good portion of my career in my many years at the University of Minnesota. That study was a very interesting design in that all of the pregnant women who were recruited were living in poverty at the time. Many of them had other risk factors as well, a low level of education. Many of them were single. They had all sorts of things that had happened in their lives, including a good number of them who had been abused or neglected in their own childhoods and had experienced domestic violence and other kinds of risk factors. Not all of them had all of those risks by any means, but we were following them because we know that even a lot of young, poor women with limited education and with other risk factors go on to care well for their children. And their children manage to thrive and develop well, and they have good relationships with their parents and other family members. So we wanted to really see what is it that distinguishes between those parents who are living in high-risk circumstances who care well for their children versus those who do kind of live out that risk and provide less than optimal care, and in many cases even abuse or neglect those children. So that was the overall design. We also were looking at some other very important questions within that study. One being, what are the long-term consequences of abuse and neglect at every stage of development throughout that long-term design? And what can we learn about breaking intergenerational cycles of maltreatment? Another major question that this longitudinal study addressed had to do with intergenerational cycles of abuse and neglect. And we know that many people who are maltreated in their own childhood do, sadly, go on and maltreat their children. You'd think that that would be kind of counterintuitive. You'd want to be so determined to provide good care, but it isn't all that easy. And so our study set out to try to identify the factors that distinguish between those parents in our study who were maltreated in their childhood, but managed to break that cycle, versus the ones who were maltreated and passed it on to that next generation. So that's a very important question, and I'll say a little more about that in a few minutes. You had also asked me, Rich, what were some of the major findings, and I'll focus on one really important piece of information that I think is very relevant to the work that you're doing with Safe Passage. It's that we found that children in the earliest months and years of life suffer particularly damaging consequences when they are maltreated. One of the most important findings from this longitudinal study had to do with the impact of abuse and neglect on children in the earliest months and years of life. And, you know, we really didn't know that much. There hadn't been that much good research that really started very early in a child's life and looked at the differences among different types of maltreatment: physical abuse, emotional neglect, physical neglect. Those are different patterns of maltreatment, but we had a general sense that they really are harmful to kids. But it's hard to measure that, and especially when it happens so early in development. But our study very clearly showed that when children are maltreated in any of those ways in the early months and years of life, the consequences are huge and they're very long-lasting, right on up into adulthood. We found that babies are very unlikely to develop a secure attachment with the parent who's maltreating, and that shouldn't be a surprise, but that means that they're missing that really key foundational piece in human development. You know, we build on those earliest relationships as we grow through the toddler, preschool, and right on up periods of development. So we know that the attachment system is very much affected. We know that children's emotional regulation, how they control impulses, their ability to learn and to think clearly and to pay attention, their empathy, how they're able to feel what other people feel as they get older. All of these kinds of things are shaped by those early experiences of caregiving, and certainly when there's a lack of optimal caregiving or a lack of good enough caregiving, children are really, really harmed. We even know that there's a higher risk of having different kinds of diseases in later life. And of course, the famous ACEs study, which has looked at adverse childhood experiences, is showing that as well. So it's not only our research, but we now understand that maltreatment early in life really affects every aspect of a person's development throughout their life.
Well, you've covered a lot of these topics since the 1980s in books and articles that you've had published about the impact of neglect, physical and emotional, that leaves no visible wounds but can have this devastating lifelong impact. Is there more that you want to say about that lifelong impact?
Yes, and you know, I was speaking about the different kinds of maltreatment that have these long-term effects, but one of the other really big findings from our longitudinal study was that emotional neglect has at least as bad, and in many cases a worse impact on lifelong development as physical abuse. And the thing about emotional neglect is that it's not easily detected by people. And babies can't speak up and say what's happening to them. And so we may not see immediate harm in the child, but we know that there's a huge risk for this harm to show up and to accumulate and multiply over time. What that feels like and what that looks like to a baby is in simple things. So babies cry to tell us that they need something from us. But when a baby cries, needing comfort or needing to be fed or played with or whatever it might be, and they don't get that response, over time, they don't learn to trust that caregiver. They don't learn to trust their own power to solicit what they need. And that just erodes their capacity to trust other people going forward and to care and have positive relationships with other people going forward. We saw in the kids in our study who were emotionally neglected in infancy or very early childhood that they had a dramatic decline on standardized tests of infant and toddler development. From 9 months to 24 months, these kids dropped significantly in terms of their ability to think and perform basic cognitive tasks and problem-solving tasks, which was something that really had not been documented before, as it happens in infancy and going into that toddler period. Over time, these kids were showing lots of behavior problems in childcare, in preschool, in elementary school. By the time this group of kids who were emotionally neglected got to be teenagers, 73% of those children, now teens, qualified for 2 or more psychiatric diagnoses. They met the criteria, the diagnostic criteria for 2 or more mental health diagnoses. That's very significant. And they went on to have difficulty in their intimate relationships and in the workplace as adults.
So, what does it take to stop maltreatment, or better yet, to prevent it in the first place?
Well, those are two big questions, and I think the answer to stopping it when it's already occurring and or preventing it before it even happens are very similar, in that we know from a wealth of research, especially over the past 2 or 3 decades, that people need, families need, intervention that is relationship-based, that is grounded in empathy and compassion and understanding, but also holding people accountable. But we need to understand parents and what they're bringing to that equation of the relationship with their child if we're going to make a difference. And so we can't just tell them the right thing to do. We can't just try to give them knowledge or change their immediate behaviors, but we have to really understand them in a much deeper way and help them come to understand themselves. And some of the ingredients of that are definitely building knowledge, particularly knowledge of child development. What does a baby mean when he or she shows separation anxiety? Parents sometimes get very angry. They say, oh, he's just trying to get at me, or, you know, he just is mad that I won't give him everything he wants. Instead of understanding that that's a basic human need, and separation anxiety is actually a positive thing, because it shows that that baby has come to realize you, the parent, are the center of their world at that stage of development. So understanding that is very important. That's just one small, not a small example, that's one big example. Toddler negativism, saying no and showing that I have a mind of my own. That's something that's very annoying for any parent. But if we understand the significance of that in the child's development, to move from being part of this tight little dyad of mother and child or father and child to being an increasingly independent young person who can have a mind of his or her own and do some things independently. If we understand the meaning of that, we're going to be able to deal with it much more effectively. A second thing that is very important is having support for yourself as a parent. Emotional support in particular. It's very hard to be a good enough parent under any circumstances. It's the hardest thing I've ever done. But it's much harder when you don't have a support system for yourself. And a third factor that's really getting to the deepest issues has to do with how you were treated in your own childhood. And I mentioned before the parents who were maltreated as children, and you know how important it is that they get what they need to be able to break that cycle. And so we know that being able to face the pain of what they experienced, being able to reflect on that and understand it, come to think about it in a new way, is what will really help them be able to go on and give their child, their baby, what they were not able to have for themselves. And I can elaborate on that in a few moments.
You're really talking about intergenerational cycles of abuse and neglect, and how to
Absolutely.
Kind of break that cycle. And I think that's what you're getting into, and maybe can you say some more about how that works?
Yes, and you know, this is it's such a big area of study in academic circles all over the world now, and this has really been a big thrust of the intervention work, the preventive intervention work that I've done going back to the 1980s. In 1986, Byron Eglin, the same professor I referred to before, worked with me to develop what we call the STEEP program, Steps Toward Effective, Enjoyable Parenting. And that program, you know, is similar to many other programs that are operating around the country and in fact around the world now. But ours was one of the very first that was grounded in a deep understanding of attachment theory and research. It was guided by that earlier longitudinal study that really informed how we approach the parents, reaching out to pregnant women again and using the pregnant woman as the point of entry into the family. But what we've learned through now, 1986 to 2020, that's 34 years that we've been doing this program, and doing it in different ethnic cultures, doing it in different parts of the world. I do a lot of training of STEEP facilitators in Germany, Australia, Switzerland, German-speaking countries. In Ireland now they're using it with parents who were in the foster care system themselves as children. And we've seen it used in Australia, New Zealand, lots of other places around the world. But what we've learned from 34 years of adapting this program and seeing how it works in different contexts is going back again to that idea of relationship-based work, but really meeting the parents where they are and doing the skill building, the knowledge building, strengthening support networks, but then really zooming in on what we call looking back and moving forward. Because the research has shown that it's not so much how you were treated as a child that shapes the way you parent your child, but it's how you've come to think about it. And we can't change how a parent was treated in their childhood, but we can definitely change how they've come to think about it. And so we encourage them to think in very concrete terms about what happened to them when they were reaching out for comfort. What happened? What did they get from their parents or from other caregivers? What happened when they misbehaved? How were they treated? How were they understood or not understood? And to face the pain of that, to be able to come to some grips with the pain of that. A second part of that is to recognize how it still affects you. Now I'm going to share just a teeny bit of my own experience here because I've really learned a lot through my own journey as a mom and a former child. My parents were teenagers. My dad dropped out of school after 9th grade. And he came from a family where there was a great deal of mental illness. My grandfather and my great-grandfather both committed suicide, both had very serious bipolar disorder, what was then called manic depression. And there was a lot of maltreatment in that larger family. And I experienced some of that in my own life. And in particular, my dad had a very explosive temper. He was kind of obsessive compulsive, and if things got a little out of whack, he could just blow up. And I was walking on eggshells all the time, thinking, am I going to trigger him? And I did not want to repeat that kind of behavior. There were other things I experienced too, but my story is not the point here. I just want to illustrate why it's important to think about this. So I did not want to repeat what my father did to me. And I have a PhD in developmental psychology, and I know a lot about parent-child relationships. But guess what? When I was a young mom, and my husband was busy building his career and was working around the clock, and I was exhausted because my child had been crying all day, had some kind of colic or something going on, and I was just totally frazzled, I found my father's behavior coming up in me. I felt his facial expressions on my face. I heard his voice coming out of my mouth. And still to this day, even with my grandchildren, who I love more than life itself, if they really push my buttons, sometimes I feel that bubbling up because that's what I learned. That was my first lesson in parenting when I was a little girl. And my mother was kind of passive, quite passive and submissive, and just stood by and didn't protect me from my father, so there was that dynamic. And I really had to come to grips with how that still affects me, and then understand what I had to do to calm those impulses, to take a deep breath, to look my kids in the eye and say, I'm sorry, you didn't deserve that. That was about me, not about you. And keep walking through that journey, which goes on and on. So face the pain, acknowledge its influence on you, and then choose what you want to repeat and what you want to leave behind. And this is really key. It's not something you do in a heartbeat. It takes a lot of time and a lot of effort and a lot of mindfulness. But I wanted to replicate my father's investment in my education. He told me when I was in kindergarten that I could be top of my class. Even though he did a lot of things wrong as a dad, he gave me a sense that I could get an education that he never had. So I was the first in my family to go to college. And I kept going. My family thought that was kind of crazy, but So, you know, we all look back and think about what it is that was good for us, even if our parents were not so great. And what do we definitely want to leave behind? And how can we muster all available resources to help us live out those choices? And that's the journey of breaking the intergenerational cycle. It's very easy to talk about. It's very hard to do, but it's not impossible by any means. And if we're well-trained professionals who know how to really share that journey, not just tell somebody what they better do, but really share that journey with them and acknowledge that we all have to live that journey. Not just the people who are coming to the attention of child protection, but all of us in our intimate relationships have some kind of that journey to walk. And so really doing that from a relationship-based perspective makes a huge difference. So face the pain, acknowledge its influence on you, and then choose what you want to repeat and what you want to leave behind. So if you don't mind, I would like to kind of wrap up my comments by just sharing something that has to do with a baby boy who came to my attention quite a few years ago when I was doing this work in the community. He was 7 months old when he was having seizures at home and was taken to Hennepin County Medical Center to be treated. And it turned out that his young father had shaken him because he wouldn't stop crying. And that's what triggered the seizures. And the healthcare providers who examined this little boy also discovered that when he was probably about 4 months old, his legs had been broken because, as it turned out, the father confessed, the baby wouldn't hold still to have his diaper changed. And so the father twisted his legs and caused fractures that had healed without treatment. And Rich, you know many stories like this, but this little boy, Jeffrey, really, his story really touched my heart. And it was a heartbreaking story, obviously, but his young parents touched my heart too, because both of them were very young. They both had a history of significant maltreatment in their own childhoods. And just a short while ago, they had been children in the child protection system themselves. And if you look at most abusive parents, that's the case. Whether they came to the attention and had any kind of intervention or not, we don't know always, but having the capacity to abuse your own child, you almost surely experience some kind of maltreatment in your childhood. And so here were these young parents who didn't know anything about infant development. The father had very poor anger management, really just didn't know what to do with his frustration when the baby wouldn't do what he wanted him to do. And the mother was so eager to have this young man, boy really, care for her that she wouldn't stand up to him, and she stood by and let him do the things he did to Jeffrey. So we had a combination of very overt physical abuse and chronic emotional neglect on the part of both parents, and the mother allowing that and inflicting it herself. So I was inspired to write a song. I'm not going to sing it for you, but I'd like to just read the lyrics because I was trying to capture what Jeffrey's experience must have been like for him. And we can never completely put ourselves into the shoes of a little baby in that kind of situation, but this was my effort. And I would ask you just to put yourself in that situation, maybe just close your eyes and just think about what this little boy is experiencing. And the song asks a very important question. The small boy reaches out for the love that he needs, but his bid for attention no one will heed. So he begins to cry, hoping someone will hear, but as no one responds, his heart fills with fear. Alone in his room with no one in sight, he cries louder and stronger out of sadness and fright, until finally his father's standing over his bed. But then the arms that should hold him reach out and shake him instead. If he's living such pain at the hands of his father, how will he ever learn to love? The small boy reaches out for the love we all need, But his bids for attention no one ever will heed. So he ceases to cry, and hope melts away as no one responds to him day after day. Alone in his room with no one in sight, he hardly can tell if it's day or it's night. And he prays that his father won't come near his bed. His heart feels like stone as his hope turns to dread. If he's living such pain at the hands of his parents, how will he ever learn to love? And I would say to all of you who are listening, we are the answer to that question. How will he ever learn to love?
So that's, I think, from the Safe Passage point of view, that's a pretty important interview with Marti. I think it's something we can use in training and with policymakers for a long time to come. I think of just powerful to me every time I see it. I get more out of it. And also just a quick shout out to Ron Stover, the videographer for this, who probably contributed at least half of his time to this video, and really, as you can see, did a nice job. So he's with Backbeat Videos, and also his day job is at KSTV. So we just want to thank Ron for his work as well. But Marti's been so generous with her time and her experience. I just want to say thank you, and please, everybody, give us your thoughts, your comments, questions. Go ahead and weigh in.
Rich?
Yes.
I would like to ask Marti, is this video available? Can you just pull it up? I would like to have some other people view it.
Well, I can answer that. We're going to, I think maybe already have put this on our website, so you should be able to access it easily there. And it'll take you to our YouTube channel. So if you have any problems with that, just let me or Stephanie know. But yeah, it's going to be out there for public, access for, a long time.
Great, thanks.
Rich, this is Judy Schumacher.
Hi.
Hi. Let's see. Should I be on camera here?
Yeah, everybody turn on your cameras if you like, please.
Yeah, Marti, thank you very much for doing this. It's such an important topic. And I'm sorry for the technical difficulties. It's tough to do things like this over Zoom. But I have a question for you. Given the lifelong trauma of child abuse that you were talking about, I always go back to prevention. How do we begin to educate the public about the developmental stages of children so that when they become parents, and hopefully not as teenagers, like your parents did, that they're better prepared to understand what their children are going through from infancy on? I always think that we're missing an opportunity to educate students in junior high or high school to have really good programs so that, classes, so that those kids at least have an introduction to what parenting is and what kids go through.
Well, Judy, this is Marti. Hi.
Hi.
And that's a very important question, I think. One organization that really has done a lot over many decades to try to help people incorporate parenting education, if you will, or education at least about core child development issues and the importance of parent-child relationships, is the National Council on Family Relations, which is based in the Twin Cities, but serves an international membership of people who both are researchers in family relationships, but also many of them are parent educators, early childhood family educators. Many of them have the credential in family life education that NCFR provides. And they have been advocates for getting that kind of learning into high schools or even in middle schools. And I think that's very important. At the same time, there's some evidence that parent education doesn't fully take until we are confronted with being parents. And so I think there are very important things we can do when couples are getting ready to have their first child. I think that's a really ripe time for preventive intervention and, broadly speaking, for just promoting good parenting, whether people have notable risk factors or not. So many things that you can do during the pregnancy when most people are very anxious, very nervous about, what's going to happen with them, what their baby is going to be like, and how they're going to get the support they need, and so on. So that's kind of a ripe point for intervention through healthcare, which is usually the primary point of access to families, developing families at that point. Public health nurses and many other professionals have been engaged in home visiting, both for targeted populations of known risk, but also just for new parents. It's a big challenge for all of us, whatever our background. So I think we really need to make sure that those kinds of supports and programs from very well-educated professionals are available to all families. And then I don't think we can underestimate the importance of targeted prevention, which really does identify, ideally before a baby is even born, both the strengths and the risk factors that parents bring with them to parenting, and do the kind of relationship-based support and education and more psychologically based intervention that I spoke about a bit in my presentation. That certainly is what STEEP is all about. Right. And there are many, many organizations that have been influenced by STEEP and are doing STEEP, or maybe calling it a different name, but doing many of the same kinds of things. Just to add one thing about what we have found to be particularly powerful in that kind of intervention, which really is a secondary or tertiary, even preventive approach, is using video recording with parents and their babies from very early on, and just recording ordinary everyday kinds of interactions: feeding, bathing, taking the baby outside to explore the grass and leaves, and all of those basic things, playing on the floor with the child as the baby moves from that newborn stage. And then watching the video, can be just 3 or 4 minutes, watching the video with the parents. And through a process we developed called Seeing is Believing, which is a part of STEEP, we ask open-ended questions that guide the parents to understand what their baby is telling them with their behavior, and to understand and recognize their own strengths and their own challenges in responding to the baby's cues and signals. That strategy has ended up being, to me, just kind of mind-boggling in its power to really help parents not just understand child development in the abstract, but to see it in practice with them and their child. Lots of fathers we've engaged with this approach across many different cultures, many different socioeconomic backgrounds, have just really been drawn into this. They get very excited when they see how they can get a smile out of their baby, or when they see how their baby responds when they stroke their cheek or rub their back, and really just kind of aha moments, breakthrough moments in terms of their capacity to meet the needs of their babies. Very often, even when they have probably not experienced that, or experienced very little of it in their own childhoods. So that's a long answer to a short question, but I hope that addresses some of those things that I think need to be a part of that. As a society, we just really have to understand how crucial this is, not only to the lives of those individual children, but to our whole society, because we need communities. We need a society that is made up of people who know how to love, who know how to be sensitive and responsive and empathic. And this is where it all starts, in that parent-infant relationship.
Thanks, Marty. It's crucial that people understand all of the ramifications of parenting. I wish everybody had access to all of the things you just said, and from early on, as young people, so they begin to think about what responsibility they have in terms of other people, not just their children, but spreading love and making sure that people understand how to support each other from infancy on. So thanks a million for all the work you've done. I know it's been unbelievably effective all over the world, like you were talking about all those countries. It is a fabulous gift to the rest of us. Thank you very much.
Thank you, Judy. And just one last thing to add to that, training of the professional workforce is really essential. And that's not just training before service, but it's ongoing support and reflective consultation, reflective supervision, which is really happening a lot in the field of infant mental health, which is a relationship-based field that cuts across many different disciplines, but where people are really getting deep training in how to do that reflective, looking back and moving forward. So I just have to mention that too. The University of Minnesota in the Institute of Child Development has a certificate program and a master's program in infant early childhood mental health. That was one of the things that I helped develop before I retired from the university a few years back. And Dr. Elizabeth Carlson, Betty Carlson, oversees that program. And many of the people who have gone through it are in leadership positions now. Program's been around for 12 years, I think, maybe 13. And so that's another thing worth mentioning, because the emphasis on training and competencies in how you do this relationship-based work really is just so crucial.
Thank you again, Marty.
I have a question.
Go ahead, Mark.
I've recently become aware of illiteracy as a high-risk issue, and 70% of prison inmates are mostly illiterate. The police are quite aware of this, but virtually no other profession is aware of this. And I wonder if we pay enough attention to very poor literacy skills, which result in school failure, I think parenting failure, high risk, I think it's multi-generational. And I'm wondering if we use that as an ACE early on in, say, a pregnant woman or early child care, and use a home visitor bi-weekly for the first 3 years for those parents as a way to teach home literacy training early on. And also the other things that go with poor parenting and parents that just don't know, just like you mentioned, child abuse is often multi-generational. So breaking that up using a home visitor. What do you think about illiteracy and those issues?
Is that question intended for me, Mark?
Yes.
Hi, this is Marty. Okay. I just didn't want to jump in if somebody else wanted to weigh in on that. I agree with you that the lack of literacy is a huge challenge. And we certainly in our work have seen many parents who are illiterate or very poor readers and have a great deal of difficulty getting their information that way. In fact, that's one of many reasons that we use the video approach we use during our home visiting, and also in group work that we do with parents who are struggling. So I think, there are a number of programs that do out there in the community that do try to teach reading to adults who have not learned it before. And so I always think it's very important that we not try to do everything within one program. And often our home visitors have many things that they're doing. Adding literacy to all of those other kinds of things may or may not be beyond their own training. So I would take an approach to partner with organizations that do teach parents reading, but also to at the same time use other modalities for helping the parents learn what they need to learn about child development and the social emotional relationship and so on. Because whether you're literate or not, there are a lot of wonderful things you can do as parents that will really get your kids off to a good start. Many programs that work with immigrant families, I think, do a really good job of, teaching English as a second language to the parents, and also helping them learn to talk and read and sing to their babies in their first language, which is hugely important, but also to kind of learn English along with their babies developing that, or their young children. So I think we need to be creative. I think it's definitely something we need to address, and we should look at what's already in the communities to kind of build on those resources and work together. And it may be that people in the literacy programs could help home visitors who might come with a medical background, a nursing background, or a psychological or social work background, help them learn the little things they can do to build their own literacy as they're stimulating their children's language development and early pre-academic kinds of reading readiness skills as well.
I didn't mean this as teaching the parents, but teaching the parents how to read with their children. In other words, the first 3 years, from what I've heard, is key to later literacy. If they don't during their first 3 years, they lose, and that's why it's a multi-generational thing. The parents don't know to do that with their children during the first 3 years. I didn't mean to teach the parents to read. I meant prep the parents for them to work with their kids, promoting early self-literacy with their kids. Because when they get to, by age 3 they have very little skills, they tend to fail.
Well, that's a helpful clarification, and sorry if I went on about teaching parents to read, but I also think that's important. I don't know of a home visiting program, quite frankly, that does not incorporate the importance of reading, talking, and singing to your baby. And for parents who are very poor readers or can't read at all, they're a little often intimidated by the idea of books. So it's important to help them know that talking and singing with the baby also really builds that child's pre-literacy so that they're much more ready once they get into preschool as a 3 or 4 year old and kindergarten when they're 5 or 6. They're much more ready then to build their reading skills. We do try to really encourage parents to use picture books and even just elaborate stories from looking at the pictures if they can't read at all, or to use the very simple books, the alphabet books and things like that, but also to really engage verbally with their children, which is foundational to literacy, even if the parents can't read very fluently or can't read anything beyond baby books.
Should parents' literacy skills be an ACE?
Well, I certainly think so. I don't know that they've been defined as such within the formal ACEs assessment, but I would definitely see that as a risk factor in all sorts of ways. And the reasons, of course, for a lack of literacy are varied. And it may be that child the parent had a significant disability that was not addressed in childhood, that they didn't get the proper services. It may be that they were experiencing educational neglect and weren't even getting into school. So it's very important, I think, to take a look at the reasons for that and what else was going on around their verbal development as well as their social emotional development as to what kind of a risk that would be. But it's awfully hard to function, especially in the information age, without being able to read. What would we do? What would we do? Most of us involved in this discussion, what would we do if we couldn't surf the internet, to find answers to important questions? And we're very, very dependent on reading in our society. So I definitely see it as an adverse experience to grow up without it.
Thank you.
So I want to read a chat comment or two, one from Nancy Jost. It isn't necessarily the reading as much as the relationship that builds brains. I don't know, Nancy, if you want to jump in and say more about that, or others can comment on it.
Yeah, I just, sometimes I think, like reading is so very important, but sometimes I think we think of it as the thing to do. And really the most important thing that parents can do is like have that warm, nurturing relationship with their child. And that could include books, it could include singing, talking. And if a parent doesn't know how to read, they can still have this very nurturing, warm relationship that will help build the brain of their child.
Thanks, Nancy. Any other thoughts on that from people?
That triggers a memory for me. This is Marty again. I was watching a video that a home visitor had shot of a father and his 10-month-old baby. And the father had been told by the pediatrician that he should read for 15 minutes every day to this child. And this father, with nothing but good intentions, was taking that very seriously. But he was reading to this baby who was squirming and fussing in his arms, trying to push the book away because there was a slightly older child on the floor playing with some very interesting toys. And it was an example of how, you know, the very literal prescription of reading for 15 minutes a day kind of ended up being implemented out of the context of that warm emotional connection that Nancy Jost was talking about. And so I think that's, you know, that's an image that I kind of hold in my head as I think about how we do these things, and whether we're good readers or not, you know, bringing books into those warm, playful, delightful interactions with our children is a great way to help them see that books are wonderful things. But also, most important of all, I believe, is to build that warm, loving connection between parent and child that has a lot of playfulness and delight and imagination in it. And literate or not, most parents can do that with some support and a few prompts and discovering that. So it pulls together some of the different points made.
Hi, Marty. I'm Lisa Hollensteiner. I'm a physician. So I had I'm curious from a study viewpoint about the kids who had physical, emotional neglect early on, had behavioral and psychological problems later. And I'm wondering if you controlled out for drug use by the mother, you know, during pregnancy, because obviously that can cause later effects. And also if the, you know, mother is still using, may also cause the neglect at the time. Did you find different effects from mothers who were just only emotionally neglectful but not using drugs and those using drugs? What did you find in those two populations?
You know, I don't recall that any analyses really controlled for that in the way you're asking. We certainly did have mothers who were using various substances, alcohol included, and you know, and certainly in our preventive intervention work through STEEP, we've had some programs that were specifically targeting substance abusing mothers, and I don't know how you for sure how to separate out the relative impact, but the behavior that the parent shows to the child, whether it's from substance abuse or other reasons, I think is a very clear causal pathway to the kinds of things we've seen. But definitely in practice, the complications associated with substance abuse, and often the erratic kind of responsiveness that we see with mothers who are maybe very loving and tender when they're straight or sober, but completely emotionally unavailable, or maybe very hyper and overstimulating and erratic when they're using. We know that those kinds of patterns are very harmful to the children long term. How you separate that out, I think, is really challenging from a methodological perspective. And I doubt, if we were to go back and look at those early data, if we had enough numbers in the cells of the different kinds of maltreatment, for example, to be able to slice that further and have significant findings. So I can't really give you an answer if that was ever teased out. I don't remember that it was, and I would think that part of that was because it wasn't possible to have large enough cell sizes. If you're, I don't mean to, bore people who are not into research methodology, but I think that's hard to do when you break a sample down into smaller subsets.
You just wonder, I mean, how many of those kids have fetal alcohol syndrome where their problems were kind of set by the time they were born, which then, and I agree still with adding on the emotional neglect, but it makes me think as a physician, do we need to go back further and continue to focus on, the parenting when they're pregnant, and what they're using,
yes.
I mean, that's obvious, yeah. I guess, but it
well,
just sad,
I've had a real concern about children who are identified as, given different clinical diagnoses without people knowing or considering and trying to discover if it's a child who doesn't show the clear physical anomalies of a child with full-blown fetal alcohol syndrome. My hunch, based on my many years of intervention work, is that there are a good number of children who have fetal alcohol effects, and that's not being taken into account as much as it should be. I'm not sure how it would change our interventions after the fact. If we did know that, in some ways it might make us less hopeful for those children. But I definitely think that attending to substance use during pregnancy, and that really has to begin well before someone is pregnant. So how we go about that, I think, is a really important question. But I certainly have seen a lot of kids where I suspected that fetal alcohol effects, at least, was an important part of their development. And, adding insult to injury, really, with the ongoing substance use of parents, which undermines their ability to be the sensitive, responsive, predictable parents that children need.
Question for Marty. Oops.
No, you were unmuted, Greg.
Okay, there we go. All right. Question for Marty. This has to do with timing. My name is Greg Gardner. I spent 40 years working in the child protection system as a direct service worker and as a supervisor. And my question has to do with the timing really needed for parents to effectively benefit from a program like STEEP, especially as it kind of bumps up against, from my experience, with some of the federal, state, county guidelines that come into play. And a lot of times those timeframes from, the county or the, state have to do with budget and financial resources. And I oftentimes felt, and a lot of, staff felt, that the timeframes that were given, they're usually like 6 months, 9 months, for a family to accomplish a case plan was simply asking too much too fast. And I'm just curious if what you would think about that in terms of your research.
Well, that's really a big controversy in the field of attachment-based interventions. And it's interesting, some researchers have come to a conclusion that less is more, and that shorter interventions with parents show more impact on attachment. Now, that's not looking at child abuse as such. The general consensus, I think, I'm stating it fairly at this point, is that it really depends on the level of risk. And for families who have the kinds of multiple risk factors and usually a history of being maltreated in their own childhood, I would say the less is more does not apply. And this is based on 34 years of experience with this program in different places. It took us close to a year with our original participants in the STEEP program to really build a relationship with the parents that was trusting enough that we could really do the deep work that I talked about in my presentation. We could dance around the edges of it in our interactions with the parents, but for them to get to the point where they could really let go of a lot of their defenses and their distrust, and really get down to looking at what they need to change and what they need to leave behind, I would say it took definitely more than 6 or 9 months. Not to say that we weren't accomplishing anything in those early months. And I know, you know, financial resources are limited and we have to work within the constraints of limited systems. But I think that we could make some changes in terms of parental knowledge, maybe begin to help parents identify potential sources of emotional support for themselves. But the really deep work didn't fully take off until we got well into the second half of that first year of life. The other thing that's very relevant here is that, you know, children are not static objects. They are changing constantly, and they're posing new challenges to parents constantly. And when children move into the second year of life, the challenges of a child's push for autonomy tap different things in parents. We found that many parents were making good progress by the end of the first year in really building a good attachment with their baby, but they still were dealing with their own childhood issues of abandonment or neglect and so on. And when their child moved into pushing away from them, running the other way and wanting to explore or saying no, the parents perceived that as a rejection on the part of the child. And that was very difficult for them to understand and accept and deal with. And so the challenges in the second year of life were very important to address. And my own conclusion based on these years of work is that if we could intervene during those first 2 years of life, that we were seeing parents we were having home visits every other week and group sessions, mother-infant group sessions every other week. So basically a weekly contact. And with 2 years of that, where you get through those two foundational developmental stages of trust versus mistrust, the attachment issues in year 1 and the autonomy issues in year 2, then you really can bring about change that will help to carry a parent through. Not that they're not necessarily going to need some booster interventions or need some special support and education or a little therapy elsewhere along the line, but those two foundational first years, I think, really give you a chance to make some deep change in parents through that relationship-based approach. It's very hard to get people to invest in that. I understand that very well, but I think we should certainly aspire to that.
Hi, Marty.
Mm-hmm.
My name is Katie Stuckman, and I'm a guardian ad litem.
I'm not hearing you well.
I'm sorry.
Oh, that's okay. Now I hear you loud and clear.
I'm a guardian ad litem, and I have a question. A lot of because of COVID-19, a lot of the programs for parenting don't do in-home visits anymore. And I'm just wondering, what do you think, how do you think, how effective and it's supposed to be intensive in-home parenting programs without the in-home parenting part? And is there anything else we can do to in place of that?
You know, I've been hearing from my colleagues in Ireland, where I've been doing training and speaking for the last several years, and they've been using iPads and doing home visiting that way and incorporating the video approach that I mentioned before that's a part of STEEP, where they're able to then, you know, record the parent-child interaction and then watch that video with the parents. And they have been very surprised with how how smoothly that's going and how much the parents enjoy it, and seem to be really benefiting from it. So I don't think that's impossible. I'm a face-to-face, high-touch kind of person, and so I'm getting a little tired of doing things virtually. But I do think that particularly if you've already had some face-to-face contact, if you're not just starting fresh with a new family, that the technology, if you can help make it available to parents who might not have it, those can be issues too when you're dealing with families in poverty or with limited internet access. But I do think there's some potential for that. I wouldn't say it's a substitute, but I think we can really observe a lot of parent-child interaction, which is very important. I think, if you had a young child right now who was, climbing on your lap as we're talking, and, that would tell me something, and how your child is behaving and how you're responding in that situation would give me helpful information, and also a springboard for talking about, how you're dealing with what's going on now with COVID, and where you're getting the support you need, and how you're helping your child deal with this, and so on. So I think technology can be a real tool, and I have heard that using it in the way I described with the seeing is believing approach seems to work very well within that framework. So I was encouraged by that. And of course, I know a lot of agencies in town are doing telehealth services and mental health services by Zoom or some related, some similar platform. So I think it's, we're all kind of experimenting these days on how to keep these important human interactions going in a very difficult time. And I think it's hard, but not impossible. Oh, I just saw a child move in the background, not a toddler, but is that your child?
Yeah. So this is great. As a guardian ad litem, I can definitely talk to the parent educator and see if it's a possibility that they can do that.
Well,
the families.
I'm glad if that was a little bit helpful. These are very tough times. I certainly know that.
Thank you so much.
Sure. Good luck to you, Katie. Katie, right? Did I get
yes.
that?
So other comments or questions, either that you have or for Marty? So I just want to say, before we sign off, that we are starting to plan for 2021 for webinars, and we're going to try to have a poll the next time, 2 weeks from now, when we have Victor Veith for you. But if you have ideas about what you would like to see us put on for webinars, please just send us a note. Just get on our website, or just and there's a place for comments, or you can just send an email to contact us at safepassagemn.org. So it's Safe Passage plural, not passages, safepassagemn.org, with comments or ideas for 2021. We'd love to hear them. Got to plan ahead, right? So Marty, thanks so much for all your time and expertise. You've been so generous, and we will be, I think, using this content for a long time to come to help move this agenda. One last call for any questions or comments? We've kind of gone over a little bit.
Well, thank you, Rich.
Thank you, Marty, for everything.
Thanks to all of you for listening and asking good questions.
And don't forget our podcast, Mommy Enough. I think you'll enjoy it.
Yep, it's all free and downloadable, lots of written resources, as well as a weekly podcast, and downloadable 25 minutes max, and just about the right length of time for a parent to take a break and hear something new. And it's not all from my daughter and me. We have wonderful guests every week. People just line up to be our guests, actually. So that's a good thing. And we learn more than we teach, I think, in that process. So thanks for mentioning that, Rich.
Yes, and I just appreciate everybody coming and joining us. We've had really a record turnout, Marty, for you, and you know, we're getting more people to join these sessions every time. So we think that's really great. Really encourages us to keep going.
Well, that's
so
great.
I think with that, I think Aviva, you're still the host. So I think with that, we'll end the webinar. And thanks again to everybody very much.
Thank you so much.
Thanks, Aviva.